PCOS patients mostly present with complaints of irregular bleeding. Infertility is more common among PCOS patients. Among 100 PCOS patients, 40 will not have any symptoms and hence they can conceive naturally. Whereas remaining 60 will need the help of a fertility specialist. The ovulation happens 5 to 6 times in a year. This will reduce the chance to conceive. This also gets exhibited because of stress or unhealthy lifestyle pattern. So PCOS must be treated in the early stage. Once it is left aloof and not treated, today let's discuss about PCOS. PCOS means polycystic ovarian syndrome. 1 in 10 women suffer from PCOS. This is Dr. Reshma Shree, fertility super specialist. PCOS mostly affects women of reproductive age group, that is between 25 to 35 years of age. PCOS patients mostly present with complaints of irregular bleeding. Irregular bleeding in sense the regular cycle happens 28 days once. Usually we consider 25 to 35 days of cycle as regular. Any cycle beyond 35 days is considered as irregular or prolonged periods or amenorrhea. All these are called irregular periods. Infertility is more common among PCOS patients. Among 100 PCOS patients, 40 will not have any symptoms and hence they can conceive naturally. Whereas remaining 60 will need the help of a fertility specialist. Infertility happens either due to anovulation, that is absence of ovulation, or due to irregular cycles, decrease in times of ovulation, that is in a normal menstruating woman, ovulation happens once in a month and that is around 12 times in a year. Whereas in irregular periods among PCOS patient, the ovulation happens 5 to 6 times in a year. This will reduce the chance to conceive and will also prevent timed intercourse. We cannot plan the time of intercourse because we cannot schedule the time of ovulation. Once ovulation happens, the egg remains alive only for 12 to 24 hours. PCOS women will have androgen excess. Androgen hormone is normally secreting in a lower amount in all the women. In case of PCOS women, the androgen hormones are in excess. Because of excess hormones, there is hirsutism, that is abnormal hair growth on the face, that is on the upper lips, chin, on chest, abdomen and other areas where male pattern of hair growth will be present. Because of androgen excess, there can be hoarseness of voice, acne, male pattern of balding, thinning of hair. When ultrasound is done, there can be a PCO appearance in ovary, that is instead of being a normal size ovary, the ovary can be very bulky and enlarged and there can be a necklace type of pattern over the ovary. These findings are suggestive of PCOS. The exact reason for PCOS has not been diagnosed so far. Genetic can be a reason. Could have not exhibited symptoms of PCOS, whereas you could have exhibited because the gene would have been silent in them because of their healthy lifestyle, whereas because of the very bad lifestyle these days, it is getting exhibited among many women. It is very common among women these days. Even chronic low-grade inflammation can be one cause for PCOS, one of the reasons for PCOS. This is because this also gets exhibited because of stress or unhealthy lifestyle pattern. Androgen excess and insulin resistance is seen among PCOS women. Insulin resistance in sense, insulin is a hormone which gets attached with the glucose and helps in uptake into the cell. Once it gets uptake into the cell, it gets utilized for energy metabolism inside the body. Whereas when there is less insulin resistance, pancreas is a hormone which secretes insulin. It starts secreting more and more insulin in order to uptake glucose for energy metabolism. Whereas when this does not happen, more insulin gets secreted. This leads to hyperinsulinemia. This hyperinsulinemia leads to increased androgen secretion from the ovary. So PCOS must be treated in the early stage. Once it is left aloof and not treated, the problem which was only affecting the ovary can affect other parts of the body. When it affects the other parts of the body, it is called polycystic ovarian ovarian disease. The syndrome becomes disease. Disease in sense, these patients will have hypertension, diabetes, obesity, hyperlipidemia, stroke, cardiovascular problems, sleep apnea, depression, psychiatric problem, endometrial cancer. So the problem should be addressed as early as possible. The most important treatment for PCOS is weight reduction. What all you can do to reduce weight? Do any form of exercise which is suitable for you for 30 minutes per day, and 5 to 10% of weight reduction can show major difference in the symptoms from PCOS. Lifestyle modification has to be planned and implemented. First, in the form of diet modification. Low glycemic, high protein and low fat diet has to be taken. White food must be avoided in PCOS patients. White food in sense, dairy products, white rice, white sugar has to be avoided and changed to brown sugar, millets. Stress level must be reduced. Yoga or meditation can be done to reduce your stress, or any form of activities which reduce your stress in a healthy way can be done. Next, your sleep pattern must be at least 6 to 8 hours of sleep is usually recommended. If your symptoms of PCOS are not getting alright with these lifestyle modification, weight reduction, then you have to go and consult a good gynecologist and get treatment accordingly. If you have any queries or doubts regarding PCOS, contact the helpline number above. We will give you consultation and counseling accordingly. Thank you.